I was diagnosed back in 2012 with follicular non-Hodgkinson's lymphoma.
My daughter was actually referred for a scan for a hormonal cyst, and they said, right, we think you better come back tomorrow because you've never had one. And so I came back the next day and they found cancer which had already spread to my lymph nodes, sadly.
I'm a retired police officer, and at the time I was experiencing a feeling in my throat like you get a breadcrumb stuck in your throat, and the last thing I expected was throat cancer, and it just knocked me over.
So I had an MRI and that identified a tumour. So they did the diagnosis on the tumour and it came back as, it's called choroid plexus, a rare brain cancer for an adult, like it's 1 in 30 million.
I was deemed semi-urgent, should be operated on within 90 days. I had a date I was given, then I was told, oh, it might be a month later. Oh no, it might be a month after that. Oh, actually people wait years in your condition. And so my whole family are suffering the sort of psychological stress that's associated with a wait in the public system. We're considering me going privately now to try and get over that, but that's going to involve taking at least $20,000 out of my husband's superannuation fund. Cancer makes you sick, it shouldn't make you poor. I was lucky because I'm based in the metropolitan area, but for those who aren't.
My understanding was if you had cancer, you'll go to Perth, you'll go to Royal Perth Hospital and they'll do a biopsy because either Bunbury wasn't geared for it at the time, or I never thought much about it, I just did virtually as I was told.
It was quite traumatic because I didn't really know exactly what was going on. I think about a month and a half or 2 months before I got the specific diagnosis. You know, I actually suffered a couple of panic attacks, which is something that I'd never experienced before.
The normal session at Charlie Gardner's is about 15 minutes maximum, and I was having up to an hour. So, I mean, that's full-on radiation, my brain and my spine. I think one thing they didn't do is they didn't give us enough information about the effects of radiation therapy. And I don't even think they were aware of the impact, although they were pretty blasé about it, being a bit of a test case for them because they've never come across this type of cancer before.
Had a trachea put in my throat and that was there for about 11 months. There came a time during the course of the treatment, and the nurse who was there said, look, I'm sorry, we've been directed that we're not supplying resources anymore to outpatients. Myself and my wife hunted high and low to try and find these dressings that the hospital had but weren't giving out. Tracked down eventually perhaps suppliers of these particular dressings, but they wouldn't give them to you unless you represented a hospital. They would give them to the hospitals, they wouldn't give them to individual patients. So eventually the only thing that we could find was a female sanitary napkin. I had nothing else to use, so eventually I went to John Castrilli, who was a local member of Parliament in Bunbury, and saying, hey, what do I do? I'm being marginalised because I've got cancer and I'm a regional patient and I can't get the resources I need, and the people who have got them won't give them to me, sort of thing. And the following day, 2 managers from Fiona Stanley drove down in a car with a bucket load of supplies for me.
One of the biggest challenges is about information, actually just getting access to information. It's pure chance who you end up seeing and what the services are that are associated with them. You're very vulnerable at the time that you're just diagnosed, and there's a huge sort of asymmetry in information. The medical professionals hold all the information, you have to find out what you can. The most important support for me was the peer support. They actually bring groups of women together in a peer support network, but they also offer financial support, which I fortunately didn't need, but practical support for those people who need it, and emotional support with counselling services, and I did use those as well.
If there was a go-to person that you could confide in, tell them some of your fears, some of the issues that you're facing, because this not only impacts you personally, it impacts your family as well.
If I was to put a headline across it, it would be the disconnect between hospitals and the policy makers, and caused a lot more angst, and you could see on the faces of the nurses, and they really wanted to do what they could, but they didn't have the tools.